Hey everyone, and welcome back. Today we're going deep, really deep, into something I think we all encounter at some point: prescriptions.
Oh,
You
yeah.
know those slips of paper that get us our meds? We're going to go way beyond just the surface, though.
Okay.
We'll be exploring their history and all the crazy processes and some really surprising facts about those seemingly simple pieces of paper.
Wow.
And by the end, you'll have a whole new understanding of this hidden world.
Cool. I'm excited.
So joining me on this journey is our expert who's going to help us decode the mysteries of prescriptions.
It's great to be here. I think prescriptions are so fascinating because there's so much more than just those instructions for medication. They represent like a long history of medical practice,
Yeah.
a very complex system of checks and balances, and really like a crucial link between you and your healthcare providers.
Okay, so let's start with the basics. When we talk about a prescription, what exactly is it?
Well, at its core, a prescription is an order for medication, typically written by a doctor or another authorized healthcare professional. Basically, it's a formal request to a pharmacist to prepare and dispense a specific medication for you.
Right, and I think most of us are pretty familiar with that scenario, going to the doctor, getting that slip of paper.
Yeah.
But let's go a little deeper.
Okay.
Our sources, including Pharmacy Orientation by Dr. Tamer H. Hassan, talk about the anatomy of a prescription, and it's got a very specific format, right?
Absolutely. The classic prescription format has several kind of key components. Your information as the patient, the date, the RX symbol, which we'll definitely get to in a minute, inscription, subscription, and the doctor's signature.
Okay, break those two down for me. Inscription and subscription, those sound pretty official.
They are. The inscription is essentially the heart of the prescription. It lists the name of the medication, either the brand name or the generic name, and the exact strength and dosage form. So, for example, it might say amoxicillin 500 milligram capsules.
So that tells the pharmacist exactly what to grab off the shelf.
Right. Precisely. And then the subscription provides instructions to the pharmacist on how to prepare the medication. It might specify the quantity to dispense, like dispense 30 capsules, and any special instructions like shake well before using.
So it's like a recipe, but for medication.
That's a great analogy.
Okay.
And speaking of recipes, that kind of brings us to the mysterious RX symbol.
Yes, I've always wondered about that. What does that squiggle even mean?
So it's actually shorthand for the Latin word recipe, which translates to take thou.
Take thou. So it's like the doctor is giving a command.
In a way, yes. It really harks back to those historical roots of pharmacy when pharmacists were known as apothecaries and would compound medications from scratch following very specific instructions from the physician.
That's fascinating. So that little symbol represents a whole history of apothecaries mixing up those concoctions. Wow. You've got to be kidding me. And how has the role of the pharmacist kind of evolved over time?
Oh, the evolution has been remarkable. While pharmacists still possess those compounding skills, most medications today are prefabricated by those pharmaceutical companies. But pharmacists play a vital role in ensuring that those prefabricated medications are dispensed safely and effectively.
Okay, so that makes sense. But let's talk a bit more about those old school concoctions, the compound prescriptions. Our sources mention some pretty interesting ingredients.
Oh, absolutely. Back in the day, prescriptions could be quite complex. Imagine a mixture with like chloral hydrate for hypnotic effects, sodium bromide for sedation, raspberry syrup for taste, and water as a vehicle.
Whoa, I'm not sure if I would want to taste that, but it's fascinating to think about how they combined all these different ingredients to achieve those specific effects.
Precisely. It was a meticulous process, and it really highlights that importance of understanding not just the individual ingredients, but how they interact with each other.
That makes sense. And speaking of interactions, that seems like a good segue to talk about the different types of prescriptions and the regulations surrounding them. I imagine not all prescriptions are created equal.
You are absolutely right. We can kind of broadly categorize those prescriptions as simple or compound.
Okay.
Simple prescriptions involve dispensing a single prefabricated medication. Compound prescriptions, like those historical concoctions we discussed, involve combining multiple ingredients to create a very customized medication tailored to a patient's specific needs.
So those compound prescriptions are like personalized medicine, but way back when.
Exactly. And then you have prescriptions for controlled substances like narcotic pain relievers.
Right.
Those have much stricter regulations because of their potential for abuse and dependence.
I was just thinking about those narcotic prescriptions. It's like they're a whole world unto themselves, right? I mean, what makes them so different from other prescriptions?
Yeah, narcotic prescriptions, also known as Schedule II drugs, are subject to much tighter regulations than your typical prescription for antibiotics. They require special prescription forms, limits on refills, and meticulous record keeping to prevent diversion and misuse.
That makes sense. It seems like there's a lot more at stake with those medications. And it's interesting to see how even in the past, they recognized the need for caution with certain ingredients, like the chloral hydrate in that old compound prescription. It seems like we've always kind of been grappling with the benefits and the risks of powerful medications.
That's a keen observation. The history of medicine is full of examples of substances that were once hailed as miracle cures, but later revealed to have serious downsides. And it really underscores that crucial role of pharmacists in understanding the complexities of medications and ensuring they're used safely and responsibly.
So let's shift gears a bit and talk about the pharmacist's role in all of this. Our sources paint a picture of pharmacists as like guardians of patient safety.
Absolutely.
It's pretty impressive.
Pharmacists are on those front lines of medication safety. They are the experts in drug interactions and dosage calculations and potential side effects. They carefully review every single prescription, check it for accuracy and potential problems, and really make sure that it's appropriate for you.
That's amazing. So it's not just about handing over a bottle of pills.
No.
They're really analyzing everything to make sure that it's safe and effective. I'm starting to see why our sources describe this process as a carefully choreographed ballet of checks and balances.
That's a fitting analogy, and one of those checks and balances actually involves something called a prescription claim check.
A prescription claim check. I've never heard of that. What is it?
So it's a system that really helps pharmacies track those prescriptions and prevent errors. So when you drop off a prescription, you'll often get like a numbered slip. That's the claim check.
No.
When your medication is ready, they match your claim check with the prescription to ensure the right medication gets to the right person.
Whoa. So it's like a safeguard against mix-ups. Wow, I never realized there were so many layers of precaution involved. This is really opening my eyes to the meticulous world behind that pharmacy counter.
It is a world of precision and expertise, and it's all designed to ensure your safety and well-being.
Okay, so we've talked about the format of a prescription, those fascinating RX routes, the different types of prescriptions, and the pharmacist's role as that safety guardian. But before we move on, I'm curious about something. Our sources mentioned the difference between brand name and generic medications. Can you explain that a bit?
Certainly. Brand name medications are those original drugs that are developed and marketed by a pharmaceutical company. Now, when the patent for a brand name drug expires, other companies can manufacture and sell generic versions of that drug.
So generic medications are basically the same thing, just without the fancy brand name.
Exactly. Generic medications have those same active ingredients as their brand name counterparts, and they must meet the same standards for safety and efficacy.
So they're just as effective.
Absolutely, and typically much more affordable.
That's good to know. And can pharmacists substitute a generic for a brand name if it's available?
Yes. In most cases, pharmacists can dispense a generic equivalent, unless your doctor specifically indicates dispense as written on the prescription.
That's really helpful information, I think, for patients to know. Could save you a lot of money.
Absolutely.
Well, this has been incredibly enlightening so far.
Yeah.
We've already uncovered so much about the history, the different types of prescriptions, and just the incredible role that pharmacists play in patient safety. But there's still more to this story, right?
Oh, yeah.
What happens after the pharmacist receives a prescription? What's their process for actually preparing the medication?
That's a great question, and it is a process filled with precision and care.
I can't wait to dive into that, but we'll have to save it for the next part of our deep dive. We'll be back soon to explore the inner workings of the pharmacy and how those prescriptions are transformed into the medications we all rely on. So stay tuned.
Welcome back to our deep dive into the world of prescriptions. Before the break, we're about to step behind that pharmacy counter and really explore the pharmacist's process for preparing the medications.
It's like we're getting a backstage pass to this whole intricate operation. I'm excited. I'm ready to see how it all unfolds.
Well, you're in for a treat. It's a multi-step process that is designed to ensure accuracy and safety at every single turn. It all starts with, of course, receiving that prescription and carefully reviewing all of the information. The patient's details, the medication, the dosage, everything.
So they're playing detective right from the get-go, making sure everything adds up.
Exactly. They're looking for any potential red flags like allergies, drug interactions, or dosage discrepancies. It's all about catching those potential problems before they become actual problems.
And then what happens next?
Once the prescription is thoroughly checked and deemed safe, the pharmacist moves on to the next stage, compounding if necessary. Now, as we discussed earlier, most medications today are prefabricated, but sometimes a specific formulation or dosage isn't commercially available, and that's where compounding comes in.
So it's like going back to those apothecary days we were talking about.
In a sense, yes. It's about using their very specialized knowledge and skills to create a customized medication that's tailored to a patient's very unique needs. It might involve combining different ingredients, adjusting dosages, or even changing the form of the medication, say from a tablet to a liquid.
Wow. That's amazing. It's like they're medication alchemists transforming these ingredients into these personalized treatments.
It is a highly skilled practice, and it plays a crucial role in ensuring that patients have access to the medications they need, even when those needs are outside the norm.
That's really impressive. So once the medication is compounded or prepared, what's the next step?
Labeling. And this isn't just slapping on a sticker. This is where crucial information about the medication is conveyed. The name, the dosage, how to take it, potential side effects, everything. It's like a mini instruction manual for your health.
So those labels are more important than I realized. They're not just there for identification. They're really crucial for making sure the medication is used safely and effectively.
Precisely. And to make sure those instructions are crystal clear, pharmacists often use what are called auxiliary labels, those additional stickers you see on the bottle.
Right. I've definitely seen those, like shake well before using labels on certain medications.
Exactly. Those auxiliary labels provide those specific instructions or warnings that are really tailored to that particular medication. It might be a reminder to take the medication with food, or to avoid sunlight, or to store it in the refrigerator.
It's like those little stickers are packed with important information. It's all about minimizing risk and maximizing effectiveness.
Exactly. It's about making sure that once that medication leaves the pharmacy, it's used correctly and safely at home.
This is fascinating. And it makes me wonder, how do pharmacists keep track of all those details for each medication? It must be a lot to remember.
It is. But thankfully, they have an incredible resource at their fingertips: drug information databases.
Okay.
These databases are like encyclopedias of medication knowledge. They provide comprehensive information on everything from dosages and side effects to drug interactions and storage requirements.
Whoa. So they've got a whole digital library of medication knowledge to consult. It's like having a supercomputer for medication safety.
It is a powerful tool that helps pharmacists stay up to date on the latest information and make those really informed decisions about dispensing medications.
It's really remarkable. Okay, so the prescription has been checked, the medication is prepared, the labels are meticulously applied. What is the final step in this carefully choreographed process?
Dispensing. This is where the pharmacist provides the medication to the patient, along with counseling and instructions to ensure they understand how to take it safely and effectively.
So it's not just handing over a bag and sending them on their way.
Yeah,
There's a real personal interaction there.
absolutely. This is a crucial opportunity for the pharmacist to answer any questions the patient might have, explain potential side effects, and really emphasize the importance of adherence to that prescribed regimen.
That makes a lot of sense. It's about empowering the patient with knowledge and making sure they feel comfortable and confident with their medication.
Exactly. And it's also about building that trust and rapport between the pharmacist and the patient.
This has been an incredible journey behind the scenes at the pharmacy. Who knew there was so much involved in getting those medications from the prescription pad to our medicine cabinets?
It really is a testament to the dedication and expertise of pharmacists. They play such a critical role in our healthcare system, ensuring that we receive the right medications in the right doses and with the right information.
I'm starting to see those pharmacists in a whole new light. They're like medication detectives, safety guardians, and patient educators, all rolled into one.
That's a great way to put it. They truly are healthcare heroes working tirelessly to ensure our well-being.
Speaking of heroes, I'm reminded of that RX symbol and its historical roots in that apothecary practice. It's fascinating how even something as small as a symbol can hold so much history and meaning.
Yeah. It's a reminder that the practice of medicine has a long and fascinating evolution. And it's a testament to that ongoing quest to harness the power of medications for healing and well-being.
And speaking of the power of medications, let's shift our focus to something that has always kind of intrigued me: dosage.
Okay.
I mean, how do they figure out the right amount for each person? It can't be just one size fits all, right?
You're absolutely right. Dosage is a complex dance between science and individual factors, and a touch of art. It's not as simple as following a formula.
Okay, so spill the beans. What goes into determining the right dose for a particular medication?
Well, it's a multifaceted process that takes into account a whole range of factors: the patient's age and weight, the severity of their condition, the specific medication being used, and even things like their kidney and liver function.
It's like a puzzle, piecing together all these different factors to arrive at that optimal dose.
That's a great analogy, and it's why it's so important to be open and honest with your healthcare providers about your medical history, any medications you're taking, and any concerns you might have.
So it's really a team effort, with the patient playing a crucial role in ensuring their own safety and well-being.
Precisely. It's about open communication and that shared decision-making to find the best possible treatment plan.
Now, I know you mentioned age as a factor in dosage. I've heard that pediatric dosages can be especially tricky. What makes them so different?
Children's bodies process medications so differently than adults. Their metabolism, their organ function, even their body composition is constantly changing as they grow.
So it's like a moving target, trying to figure out the right dose for a child.
Exactly, and it requires a deep understanding of pediatric pharmacology and a lot of caution.
It's amazing how much specialized knowledge goes into this field.
It is, and it really highlights the importance of having those pediatric specialists involved in the care of young patients.
Okay, we've talked about age, weight, and even organ function as
Yeah.
factors in dosage. Are there any other things that come into play?
You bet. The form of the medication also plays a big role. A pill is going to act very differently than, say, an ointment or an injection.
That makes sense. The way the medication is delivered to the body is going to impact how it's absorbed and processed.
Exactly. And even seemingly minor changes to a medication's form can have a big impact. For example, switching the base of an ointment can affect how well the active ingredients are absorbed through the skin.
Interesting. So it's not just about what's in the medication, it's also about how it gets into your system.
Precisely. And that's where those meticulously crafted labels come in with their specific instructions on how to use the medication.
Right. Those labels are starting to make a lot more sense now. They're like mini guides for getting the most out of your medication and avoiding those potential pitfalls.
They are an essential part of that safety net, ensuring that the medication is used as intended and that patients have the information they need to make informed decisions.
This is so eye-opening. It's like we're peeling back the layers of complexity and revealing this intricate dance between science and expertise and patient care that goes into every single prescription.
It is a fascinating world, isn't it? And we're just getting started.
I can't wait to dive even deeper, but we'll have to save it for the next part of our deep dive. Stay tuned as we continue to explore this fascinating world of prescriptions and uncover even more insights into those little slips of paper that has such a big impact on our health. We're back and ready to wrap up our deep dive into this whole world of prescriptions. We've covered so much. I mean, from the historical roots of that RX symbol all the way to the super meticulous process of dispensing those medications.
It's been a real journey, hasn't it?
It has.
We've explored the different types, we've delved into those complexities of dosage, and even gotten a little peek behind the pharmacy counter to see how those slips of paper are transformed into the medications that we all rely on.
And I don't know about you, but I feel so much more informed and just more appreciative of all the expertise and care that goes into every single prescription.
It is a hidden world.
It really is.
Most people don't think about, but it really has a profound impact on our health and well-being.
Absolutely. Now, before the break, we were talking about dosage and how it's not just as simple as taking a pill like a certain number of times a day. There's a whole science behind it, right?
You're right. Dosage is like this carefully calculated recipe where each ingredient is playing a crucial role in achieving that desired outcome. And one of those ingredients is the frequency of administration. So how often you take the medication.
That makes sense. Some medications you take once a day, others you take multiple times a day. There must be a reason for that.
There is. It all comes down to how the medication interacts with your body, how quickly it's absorbed, how long it stays active, and how it's eliminated.
Okay, so break it down for me. How does the frequency of administration play into all that?
Well, some drugs have a very short duration of action,
Right.
meaning they're eliminated from the body pretty quickly. So for those medications, more frequent dosing might be necessary to maintain that consistent therapeutic effect.
So it's like keeping the medication level topped up throughout the day.
Exactly. But then you have other medications that have a much longer duration of action or a cumulative effect. So they build up in the body over time. And if you take those too frequently, it could lead to toxicity even if the individual dose seems safe.
Okay, that's a little scary. So it's not just about how much you take, it's also about how often you take it.
Precisely. And it highlights the importance of following your doctor's instructions really carefully and asking questions if anything is unclear. Your pharmacist is also a great resource for understanding those dosage instructions and any potential risks.
They really are the medication experts. Our sources also mentioned that the route of administration can affect the dosage. What does that mean exactly?
It means that how a medication enters your body, whether you swallow it, inject it, or apply it to your skin, can impact how much is absorbed and how much actually reaches its target.
So an oral dose of a medication might be different from an intravenous dose of the same medication.
Exactly. Some medications are absorbed very efficiently through the digestive system while others are not. And then you have medications that need to bypass the digestive system completely, like those given by injection.
It's like there's a whole transportation system for medications within the body.
Yeah.
And that route of administration is determining the best way to get those medications where they need to go.
That's a great analogy, and it's why it's so important for pharmacists to be aware of those different routes of administration and how they impact the dosage and the effectiveness.
Another layer of complexity in this already intricate world.
It is, but it's a complexity that is essential for ensuring safe and effective treatment.
Now, speaking of safety, our sources mention that pharmacists are always on the lookout for potential drug interactions. What are drug interactions and why are they so important to consider?
Drug interactions occur when one medication interferes with the action of another medication, and this interference can happen in a variety of ways. One medication might block the absorption of another, or it might speed up the breakdown of another. It can even enhance or diminish the effects of another medication.
So it's like those medications are battling it out inside your body.
In a way, yes, and these battles can have serious consequences. It can lead to unexpected side effects or even make medications less effective.
That's a bit unnerving. So how do pharmacists prevent these drug interactions from happening?
They play a crucial role in really identifying those potential interactions. They have access to these really extensive databases that actually track drug interactions, and they carefully review your medication list, including any prescription drugs, over-the-counter medications, and even herbal supplements.
Wait, even supplements can interact with medications?
Absolutely. Supplements contain active ingredients that can have pharmacological effects, and those effects can sometimes clash with medications you're taking.
I never even thought about that. It's like anything you put into your body,
Like,
whether it's a prescription drug or what seems like a harmless supplement, can have unintended consequences.
that's why it's so important to keep your doctor and your pharmacist informed about everything you're taking, even those over-the-counter remedies you might not think are a big deal.
It's like giving them all the pieces of the puzzle so they can see that full picture of your health and make really informed decisions.
Exactly. The more information they have, the better equipped they are to protect you from potential harm and ensure that you're getting the most benefit from your medications.
Well, I have to say, this deep dive has been such an eye-opener. I feel like I've gained a whole new level of understanding and respect for this world of prescriptions.
It's a world that's often overlooked, but it plays a vital role in our health and well-being.
Absolutely. So as we wrap up this exploration, what's the one key takeaway you want our listeners to remember?
I think it's this. Those little slips of paper that we call prescriptions are more than just instructions for medication. They're really a gateway to a complex system of knowledge and expertise and care.
That's a beautiful way to put it. They really do represent a collaboration between science, healthcare professionals, and patients, all working together to achieve the best possible outcome.
I agree.
Well, on that note, we've reached the end of our deep dive. We hope you've enjoyed this journey with us into this fascinating world of prescriptions and that you've gained a newfound appreciation for all the intricate processes and the dedicated professionals who make it all possible.
Yes. And we hope you'll take this newfound knowledge and use it to be more informed and empowered in your own healthcare journey.
So the next time you pick up a prescription, take a moment to just reflect on that incredible journey that it represents. From the doctor's office to the pharmacy counter, and then finally to you, it's a real testament to that ongoing collaboration between healthcare professionals and patients, all striving for the same goal: optimal health.
Thanks for joining us on the deep dive. Until next time, keep those brains curious and those questions coming.